Okay, so we have a question in front of us from 2020 AIMS. So a psychotic patient developed a voluntary purposeless movements and was once observed to be standing still for hours with waxy flexibility and negativism. Okay, so what is the appropriate medical management? Okay, A is haloperidol, B is lorazepam, C is clonidine, and D is propranolol. So first we have to understand what is the examiner talking about or asking about. Okay, so we see voluntary purposeless movements, okay, waxy flexibility and negativism. Okay, these all three are part of catatonia. Okay, so the questioner, so the examiner is asking about the treatment of catatonia. Okay, now this can be very confusing because you see psychosis written and catatonic symptoms given. So many of the students will be confused between haloperidol as a treatment of psychosis and lorazepam, which is a treatment of catatonia. So the answer over here is actually benzodiazepine lorazepam, okay, which is the drug of choice for catatonia. Now let's see. So this is the physics of catatonia I wanted to show, highlight. Okay, so the mannequin effect. So waxy flexibility is much like a mannequin. Okay, so limb stays wherever it is placed. Okay, so if you keep it over here, hold it like this, it will stay over here. Okay, so this is waxy flexibility. You keep it over here, it is like this, waxy flexibility. Okay, negativism is like it's a brick wall. Whatever you try to do, okay, so the patient is not going to allow you to do that. Okay, so like opposing or not responding to instruction, that is negative optimism. That is negativism. So actively opposing is called active negativism, and not doing what you are telling is passive negativism. Okay, so catatonia is a physical before psychological. It manifests as profound psychomotor dysregulation on a background of purposeless movement. Now you have to understand this point. Okay, so the diagnostic paradigm. So often people have this misconception that catatonia is a part of schizophrenia or psychosis spectrum. No. So catatonia can arise from medical symptoms, medical problems like say hepatic encephalopathy or even diabetic ketoacidosis or even thyrotoxicosis. Okay, much like psychiatric illnesses like schizophrenia or even bipolar disorder. Okay, so this is a very wrong misconception. So like completely misconception that this catatonia means psychosis. No, this is the most dangerous assumption that catatonia is a mere subset of psychosis. No, this is a wrong diagnosis. So catatonia is considered a neuropsychiatric complication, okay, much like delirium. So delirium, just like it can have psychiatric causes or medical causes, catatonia also can have medical causes and psychiatric causes. So whenever we treat catatonia as catatonia only, okay, irrespective of whatever it is. So catatonia from diabetic encephalopathy or thyrotoxicosis or hepatic encephalopathy, okay, will be treated with lorazepam, as much as catatonia arising from schizophrenia or bipolar disorder will also be treated with lorazepam. Okay, so catatonia, irrespective of the etiologies, will be treated with lorazepam benzodiazepine. Okay, so of course, the underlying etiology, whichever it is, so if the patient has diabetic ketoacidosis or schizophrenia, that has to be treated. Okay, but the question is, how do you treat catatonia? And the answer remains same: benzodiazepine, lorazepam. Okay, now this you must remember, must not confuse in the exam. Okay, so lorazepam and Ativan is the master key. The first line pharmacological treatment is a benzodiazepine, not an antipsychotic. Okay, specifically the lorazepam challenge test is, okay, so this is one of the key things that you can also remember in addition to this, which can get asked in the exam also. So not only it is a treatment, but also can be, be used as a diagnostic challenge test. Okay, okay, so it opens the door to both diagnosis as well as immediate management. So there is something known as lorazepam challenge test, where we give 2 mg and then additional 2 mg if no response happens. So let's say 4 mg, and if there is response to catatonia, that means we are confirming sure shot that it is catatonia. Okay, let's see what is there in writing. So yes, so the vignette is describing catatonia waxy flexibility. Okay, the limb stays where it was placed plus negativism. Okay, on a background of purposeless movement. Okay, so catatonia is a psychomotor syndrome in its own right. It does not require an underlying diagnosis of schizophrenia. First line pharmacology treatment is benzodiazepine, not an antipsychotic. Okay, so let's see what the Seminars textbook of psychiatry says. So for most patients, benzodiazepines are the mainstay of treatment for catatonia. There is most evidence for lorazepam. Okay, although diazepam and clozapam can also be used. After lorazepam challenge stage, a total dose of 4 mg should be started. Okay, this is what is usually followed. And also, the first pharmacological intervention in catatonia should usually be lorazepam challenge. Okay, so it has got 3 distinct roles. Okay, so number 1, support the diagnosis of catatonia, because once there is a response to lorazepam, you can confirm that this is catatonia. This has to be catatonia because nothing else will respond to catatonia. Okay, also predict subsequent effectiveness of further benzodiazepines. Like further, if there is a second, third, fourth episode of catatonia, we know that lorazepam is going to work in this patient, and also elucidate the underlying psychopathology as well. Okay. So why other options are wrong? Because haloperidol, okay, it's treatment for psychosis, okay, not catatonia, and perhaps it can worsen or can precipitate NMS in this scenario. Okay, its state itself mimics the catatonic stupor or rigidity. Second, clonidine, okay, so it's an alpha 2 agonist used for hypertension, opioid withdrawal autonomic symptoms, and ADHD. It has got no role in catatonia as such. Okay. Third is propranolol. It's a beta blocker used for akathisia, okay, which is a antipsychotic induced side effects. Okay, so it's written out chapter 15, not in catatonia. Okay, so it's akathisia treatment, not catatonia treatment. Okay, don't get confused between propranolol for akathisia and catatonia. Okay, so hopefully you have learned something, because this is one of the recurring questions that is going to come in the subsequent exams. So catatonia has to be treated with lorazepam or benzodiazepine. So whenever you see catatonia, go for benzodiazepine. Okay, irrespective whatever the underlying etiology is. Okay, thank you.